Over to you.
All right, Trina, thank you so much. Well, constantly telling your child to brush their teeth can be a hassle. The founder of Tooth Tales Pediatric Dentistry, Dr. Timothy Chen, is here with us today to show parents how to finally get your kids to pick up the toothbrush and brush their teeth.
Exactly.
Welcome.
Thank you. Thanks
Wonderful
for having me.
to have you here. So you were telling me that you really need to start the dentist visits early on in the child's life.
Yes, definitely. Definitely. It's very important because a lot of parents aren't aware. They, unfortunately, they usually wait till their child's in pain before they come see the dentist. But it's very important that we actually start seeing them actually by their first birthday or actually when their first tooth erupts.
Okay. Now, you were actually telling me that moms out there who are expecting also really need to take good care of their teeth as well.
Definitely, because you have to see, dental cavities, it's something that you have to look at as an infectious disease. So it's something that the bacteria from the mom can actually be transferred to the child. So it's important that even the expected moms, that they have to get their mouth healthy before they actually have the child, because they have to be careful that they may transfer that bacteria to the child.
Right. What is the number one thing that you tell your patients when they go visit you?
Number one thing, my patients, well, of course, stay on top of the brushing, but it's very important, and, watch out for those sugar bugs.
Okay. So you were saying that they have to start bringing in their children around when about a year old.
Correct.
And those baby teeth are in place until about 5 years old. So why do they have to bring in the children if those teeth are going to fall out eventually?
Very good point, and that's a question that I often hear. It's so important because when you start good habits from the beginning, it's going to prevent a lot later on. Like I mentioned before, with the cavities starting to develop or the bacteria getting there in their mouth, is that you really have to start from them, because it's shown that, kids that are high risk when they're young with their baby teeth, you're going to be at high risk of getting cavities with your permanent teeth.
Interesting. Okay.
So it's very important.
Now, school is right around the corner.
Yes.
So we need to make our appointments quickly, right? Are you filling up?
Correct. Exactly. That was the busy time. Very busy time. So definitely, it's important to go see them now, especially you don't want to take your child to school. So all the parents are taking advantage of that.
Right. Okay. Now, what is the difference, between taking? I would think the answer is obvious, but just in case, what is the difference between taking your child to just a dentist and then a pediatric dentist?
Well, it's pediatric dentists. They're there. They studied an extra 2 years to actually.
An extra 2 years.
Extra 2 years.
Interesting.
Specifically just to treat children. And what you have to be aware of, pediatric dentists definitely, they know how to control the behavior, because of course kids don't really love to come to the dentist.
Of course.
So it's very important that we have a nice demeanor there, and myself and also the staff or any pediatric dental office that you go to, it's just a happy and an inviting experience.
What kind of atmosphere do you create for them?
Well, the moment you come in, with pediatric dentistry, you always say that you have two patients. So we always make sure that we make the parent comfortable as well as the child. So from the moment they get there, you have to have a lot of interaction, talk to them a lot more personable. Yeah. The environment I have at the office, it's a lot of kid-friendly, very open, very colorful. So that makes it a lot easier.
And Dr. Chen, what about, for children that maybe have to go visit you for more serious issues with their teeth? How do you make that situation more comfortable?
Right. Well, it all depends. It all depends because it depends on the behavior that they have. So there are different ways that we treat them. So we have the nitrous oxide, which we call a little laughing gas. We have sedations that we do as well. But to do the treatment itself, we kind of make it fun, because we call the little, say the handpiece, we call it Mr. Whistle. You have the suction, it's called Mr. Thirsty. Little things like that. It does make it a very playful environment.
Yeah. All right. Well, Dr. Chen, thank you so much for being here. So and Tooth Tales Pediatric Dentistry is located in Miramar. For more information, you can visit their website, mytoothtails.com, or give them a call at 954-236-5273. All right, Sherry, back to our guest of honor.
Yes, our guest of honor. We have Alexis Bellino here again, Real Housewife from Orange County, and we are talking about Alexis Couture today. And this is your baby. I mean, from beginning till end. This isn't you just pegging your name on a dress line already.
No.
So what has the process been?
Stressful. A lot of sleepless nights. But the second line that we're working on now is coming along a little easier, because this was my first time at it.